My name is Robert Cooper. I'm a family medicine doctor, trained out at Texas Tech and did my residency in Amarillo. But my beginnings are I grew up in East Texas, son to a coach who ended up being a principal and superintendent. And my mother was a small business owner, so I've always kind of had an entrepreneurial spirit. I honestly always wanted to be a doctor. I originally wanted to be a vet, but then ended up my junior year of high school taking A&P. Decided I loved the human body, loved how we are created and all the intricacies. So I decided that at that point I wanted to do med school. So went out to Texas Tech with some great buddies that I'm still lifelong friends with, and went out there, had a good time at Texas Tech, and then was blessed to, after undergraduate degree in clinical lab science as a lab tech, I worked at Parkland for a year and a half, got some awesome experience there, and then got into medical school back out at Texas Tech. For the past couple of years, I've kind of been feeling this tug to do a private practice. My wife's been talking to me about it. I've been really thinking about how to go about it. Recently, for the last year or two, I've been covering a newborn nursery at the hospital, and kind of got to know Dr. Zulfer as a pediatrician there, also covering newborn babies. And I could just kind of tell that as we would hand patients off or share patients, that we really had very similar styles. She's very kind. I could tell that she treated patients the right way. Our style of medicine was very similar. So when it really came down to my wife and I deciding to take that leap, I just decided, hey, it would be so cool to see where she is in her practice and as far as her life goes. And when I reached out to her, everything just kind of went from there. One domino led to another domino falling, and doors were opened. And before you knew it, you could just tell it was going to be a natural fit. And so we both just really honed in on the idea of creating Weatherford Pediatrics and family medicine so that we could have both pediatrician and family medicine and take care of the families very well. The clinic here is going to do something where it's going to a little bit deeper, where Dr. Zulfer and I get to have our own small business, and we are looking forward to taking care of the families and having direct relationships with them, getting to take that walk with them through life. I think that one thing that I'm really looking forward to, instead of doing ER work and hospitalist work where you just get to see patients for a snippet of time, this is going to be a little bit different, where we can really walk through life with them, create relationships with the family as a whole, and get to know them. They can get to know us and kind of have a little bit more of a direct relationship.